And now, it's BoomerLife, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is BoomerLife on CIL 650.
Well, good morning and welcome to Boomer Life here on CIL 650. Sterling Fox with you, joined in studio to talk about these very special health category of varicose vein therapy and veins in general is Dr. David Liu from FalseCreek Healthcare Center in Vancouver. Dr. Liu, good morning and welcome.
Good morning. Thank you so much for having me on the program today.
Well, it's my pleasure to have you join us. Now, I am told that you are an interventional radiologist. What's that got to do with veins?
Sure. It's a question that's quite common, but once you understand what the principles are behind interventional radiology, it makes a lot of sense.
Okay.
As an interventional radiology, I first start off as an MD or a medical doctor, so I go to medical school.
Right.
In order to become a radiologist, which is the first part of the designation, I undergo a 5-year residency program, and actually I did that residency program here at University of British Columbia.
Okay.
In order to add the interventional part to my name, I had to do additional training, which is referred to as fellowship training, and I did it at Northwestern Memorial Hospital in Chicago, Illinois.
Okay.
Now, that training in interventional radiology really allows me to use modern imaging techniques such as CAT scanners, MRI, X-ray machines, and ultrasound to perform minimally invasive surgeries and operations on blood vessels and on various organs in the body.
Okay.
So as opposed to having an open incision or a very large operation, we can literally perform very advanced procedures through 4 or 5 millimeter incisions, or in the case of treating venous disease, 2 millimeter incisions, and potentially cure people from conditions that may have required very elaborate surgeries that may also have associated complications or associated prolonged recoveries.
Okay, so now you work in very close conjunction with a vascular surgeon, Dr.
That's correct, Dr. Joël Gagnon.
Right, so you're the team. So you do the setup and he does the cutting, so to speak. Is that? And I know I'm oversimplifying to a silly degree, but that's the way the tag team works, right?
Absolutely. The way I try and describe our relationship is like peas and carrots. We're better together than we are as individuals.
Okay.
We both come into the philosophy of treatment with very different approaches because of our training, but we both converge upon the treatments and management plans that we think are the most appropriate for an individual person at that individual case. So as opposed to trying to treat all venous disease with one big hammer, we actually have a number of different hammers. We have a number of different strategies that we collaborate with in order to provide the best care for that person.
And in the past, it's been more of a cookie cutter format. We have 1 through 4 potential remedies or scenarios that we deal with, and you will fit into one of those 4 categories, and we will take care of you. And that was that. There was minimal flexibility in terms of dealing with the individual. Correct?
Absolutely. The choices were limited and they weren't that great.
Right.
If we look back in history of varicose veins, we can actually go back to Roman times. Varicose veins and venous disease goes back thousands of years, as long as we've been standing on 2 legs. And if you think about the Roman sandal, how the laces cross over the calf, those were actually primarily designed to control the symptoms associated with varicose veins.
Really?
Yes, and it took 1,000 years before we started looking at surgery, which is literally taking out or ligating and stripping the veins in order to better treat symptoms. But sometimes the medicine is worse than the cure because of the side effects,
Sure.
the potential pain and recovery. And it's only been in the last 15 to 20 years that we've really been able to understand venous disease to the point of actually developing and inventing new techniques that are minimally invasive and maximally effective.
Right. Now, can you hold my hand for a couple of seconds and take me right back to week 1 of medical school here, Doc? What's the difference between veins and arteries, and why are you all about veins instead of arteries?
Sure. It's actually also a very important question and a very important principle to understand. As we all know, blood circulates through our body.
Right.
It comes from the heart and it goes back into the heart. The blood vessels that push the blood from the heart out into the bodies, out all the way to our thumb or our big toes, are known as the arteries.
Okay.
And those are the ones that are associated with PAD, or peripheral arterial disease, with heart attack, sometimes with stroke.
Okay.
Now, the blood vessels that actually push the blood back into the heart, those are the veins, or the venous system. And the venous system is something that has been very under-recognized because there really hasn't been a lot of opportunity to be able to treat veins effectively.
So arteries push the blood out, veins deliver the blood back to the heart.
Absolutely correct.
Okay, all right. So that's the in and out of it all.
Correct.
Right? So what has been so misunderstood about veins as a result of perhaps a preoccupation with arteries?
Absolutely. I think because what happens with arteries, or when things happen to the arteries, is quite dramatic. And just like on a television show, when you see somebody crashing through the doors in the emergency department, that's a type of arterial emergency. Venous disease is something that is insidious. That's a medical term for saying it's slow, it's gradual. Now, married with the fact...
And the non-medical term for it, nasty.
Nasty.
It can be, can't it?
It can be, and it really is a spectrum of disease. It's literally like death by 1,000 cuts. You really don't notice it. You really don't notice it until it becomes severe or symptomatic. Now, it gets the layer cake, or the onion gets a little bit more complex when we peel back the next layer, because fundamentally, when we have a reversal of that process within the veins, in other words, if the blood is not being carried back to the heart and potentially stagnating, that's when we have a problem, especially when relating to venous disease within the legs.
So is that typically, Dr. Liu, the most common place for vein problems in people's legs as opposed to any other part of their body?
Yes, and there's actually a reason for that, because if you think about it, cats, dogs, and cows don't have varicose veins.
Okay.
And the reason for that is because they're always on 4 legs. And as a result of being on 4 legs, the amount of pressure that the blood is pushing on the legs is significantly less, because we measure that pressure as the distance from the heart to the floor.
Okay.
Now, a couple of million years ago, we all decided to stand up. And as a result of that, our heart became significantly higher compared to the floor.
Sure.
And that causes a very large pressure gradient or water gradient to push against the veins. Now, the veins have methods of compensating for that. Mother Nature has given us valves to be able to minimize the chance of the venous flow in the legs going in the wrong direction.
Okay.
But once those valves start breaking, that's when the flow of blood reverses in the veins. That's when the blood can't return to the heart, and that's when it starts pooling, enlarging, causing the veins to dilate, and subsequently causing them to become varicose, and in extreme situations actually causing problems with the adjacent tissue, the muscles, the bones, and the symptoms that people experience from venous disease.
Okay, lots of questions for you here. Boy, have you just opened up a Pandora's box. But first, I need to know about this, because this is all quite new to FalseCreek Healthcare Center. You and your colleague have put together EVA Vein Care. And is that a private company that works in conjunction with FalseCreek Healthcare, Dr. Liu, or is it a part of FalseCreek Healthcare? Explain the relationship, if you could, please, and tell us about EVA.
Sure. EVA Vein Care was really created based on the fact that we feel that we have a very strong team, a team of 2 phlebology nurses with over 40 years of experience in treating venous disease, a team that consists of interventional radiology as well as vascular surgery, and we really wanted to be able to encompass that concept into a single entity, and that's why we had formed EVA Vein Care. Now, in terms of the treatments that we do, we offer a full spectrum of treatments. Some of them are very basic and may require just a minor procedure or a minor injection. Some of them are a little bit more elaborate and involve the latest state-of-the-art techniques in endovenous reconstruction or endovenous treatment, which is basically operating on the blood vessel from the inside.
Okay.
Now, in order for us to do that, we require advanced facilities. We do require a state-of-the-art facility to be able to conduct some of these minor operations and procedures. And FalseCreek Healthcare Center does have some of the best state-of-the-art operating rooms that we can access in an expedited fashion.
Right. Now, and you also, I should mention, as if the doctor doesn't appear to be a busy enough fellow as it is, he's also an associate clinical professor at the University of British Columbia. Back to the alma mater to shake him down for some cash. And good for you. So you have professorial duties at UBC. You operate at FalseCreek Healthcare Center. You and your team. You're a dad. You're just an incredibly busy guy. So, and one of the things that you mentioned a few moments before we began today is that some of your students are not only med students from UBC, they're also very highly developed students from all over the world who come to Vancouver to learn specific techniques, right?
That's correct. We've had a very long heritage in Vancouver and at University of British Columbia of being on the forefront and the frontiers of interventional radiology, dating back to the early 60s with the arrival of an individual by the name of Yochum Berhena. We've treated everybody from the Iranian Shahs to royalty. We have trainees coming in from around the world, people who are already interventional radiologists coming to learn the latest techniques and the latest methods of therapy. Just off the top of my head, we've had people coming in from Australia, from Singapore, from Sweden, from Germany, from Saudi Arabia, from Ireland.
It's fantastic.
It makes for a very exciting and dynamic environment, and I think for the most part we're offering a contribution not only to the interventional radiology community, but also offering the best healthcare that we can to British Columbians.
Well, I was just going to say, the net benefit to us British Columbians, having you and people like you training and working with people from all over the planet, the net benefit to the health consumer in our province has to be just complete positives, because here you are literally rubbing shoulders with the best in the business every day.
We're very fortunate that way. Our reputation precedes us, and that allows us to innovate and as well as provide that optimal point of care for what we consider our most important population, which is our British Columbian patients and clients.
Absolutely. And you talked about the requirement for state-of-the-art operating theaters such as exist down at FalseCreek Healthcare Center, but we've also learned through meetings with some of your colleagues down there that some of the radiological equipment, some of the imaging gear that they have, pardon my lack of technical terminology, is literally state-of-the-art and able to, the research goes on with labs and other facilities all around the world on a daily basis.
Yes, in fact, FalseCreek has actually looked forward and really been able to plan ahead for not only what is considered the state of the art, but what the future holds.
Sure.
With future installations of some of the most advanced MRI scanners on the planet, 3.5 Tesla scanners, with the operating suites as I described, with top-of-the-line ultrasound equipment, it really makes our job as physicians and diagnosticians much easier when we have those tools available to us and readily available to us.
It's interesting that you would describe at such glowing length the quality of the facilities that you work in every day, even though what you and your team are constantly striving to do is less interventionist work, right? You have the ideal, the optimum conditions to do the work in, but you're really trying to get away from that, aren't you?
Absolutely. Sometimes we coin the phrase in interventional radiology, cutting edge without the cutting. And really you need the ancillary equipment to be able to give you the information that you need that may be absent as a result of the minimally invasive techniques. So for instance, if we're trying to open up a blood vessel, let's say an artery within the leg or within the arm or within the brain or in the adjacent areas, we can't really split open and look at it like cracking open an egg.
Sure.
We need specialized x-ray equipment. We need specialized measuring tools to be able to do so. And each of these tools, although they're very, very tiny in the body, have big boxes around them. And the big boxes are usually the larger pieces of equipment that we need to be able to perform these state-of-the-art procedures.
Interesting stuff. Our guest from FalseCreek Healthcare Center and Eva Vein Care is Dr. David Liu, and we're just getting started here on Boomer Life on CIL 650. It's all about veins on the program today. Ha! Yeah, we knew you'd be interested. We're back with lots more, too, right after this.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650.